So it's a pleasure to be here with you this evening. I've been asked to talk about exercise, immunity, and COVID-19. I'm also going to fuse a little bit about exercise is medicine. So I know that a number of you know about the global initiative, and perhaps they're a little bit different knowledge with respect to exercise itself. So I am an exercise physiologist. I teach in the kinesiology program at Jacksonville University, and I run our Healthy Campus and Exercises Medicine on-campus initiatives. I also have a master's in public health and epidemiology, specifically physical activity epidemiology. So I like to infuse that public health information into my practice and what I teach my students. I'm also a clinical exercise physiologist certified through ACSM. So without further ado, I would like this to be pretty interactive. So I mentioned that to Ashley, and I do hope that you either put something in the chat box. If I can't see it, I'll ask Ashley or Alan to share that, or you can just unmute your mic and participate. So exercise. When you see the word exercise, what comes to mind? Just tell me off the top of your head. Shout it out. Shout it out or chat it up. What do you think of immediately?
Movement.
Say again?
Movement.
Yes, movement. Good. What else? Thank you.
I think intention as well.
Okay, intention. So intentional, movement. What else? Give me two more.
We have getting fit, working out, sweating, healing.
Yes. Okay. Sweating. That's a product of exercising, right? So some of it is what we think of the actual movement. Some of it is how it makes us feel. Some of it is what happens because of it. Okay, good. Exercise, good or bad? Silly question. Right? Most often, if you would say exercise to someone, they would say, oh, exercise is good. But I want you to think as we go through our discussion this evening that yes, exercise is good. However, what people don't realize is that it's extremely bad for our health if we don't move enough. In fact, the evidence or research suggests that it's as bad as smoking a pack of cigarettes a day. So they hold similar risk. So if someone says, I don't smoke, but I don't move enough, it's okay. It's really not okay. And I'm going to illustrate some reasons why. Okay, so maybe you'll have a different mindset when it comes to exercise, and maybe you can help spread that word to others. In this particular slide, we see the top 10 leading causes of death in 2019. Okay, a number of these are chronic disease states. Those in red are directly related to not moving enough, or i.e. physical inactivity. Those in yellow are indirectly related. So 6 out of our top 10 leading causes of death in the United States are related to not moving enough. And we're talking about physical inactivity as an independent risk factor, okay, not tied to obesity or other chronic disease states. Okay, so let's keep that in mind as we move forward. The 2018 physical activity guidelines are it's a compilation of the decades of research on exercise. It's similar to the dietary guidelines that you guys are probably familiar with from high school. And there was an advisory committee that created a report, and every 10 years this is updated. The first one was in 2008, now we have 2018. And we have additional evidence to support the importance of exercising and the risks of not moving enough. So our current guidelines are at least 150 minutes per week of moderate to vigorous intensity activity. Okay, even more so if you're trying to lose weight or trying to maintain weight loss. Okay, so those are our current guidelines for Americans, and we're talking about aerobic type activity here. They're also strength training recommendations as well. Okay, so according to the evidence that we've collected or that has been collected over decades, we know that regular exercise can help reduce the risk of many different cancers that you see here. Colon cancer, for example, because it reduces transit time. So a wonderful preventive medicine that exercise is. Also, a good management medicine, meaning that even if you have a chronic condition, You can reduce the severity of that condition. You can reduce the risk of other chronic diseases that might occur, and you can prevent more serious complications by just moving more. Okay. In fact, there's not one thing that you can do in a single day, short of liposuction, to be able to reduce obesity. But every single day, you can reduce your risk of chronic disease by just moving enough, irrespective of your weight. And we'll talk about that in a minute. Exercising the brain. Exercise is an amazing medicine for depression and anxiety. And there's evidence or research to suggest that it's as effective as behavioral therapy or Prozac for depression. Now, nobody's saying you should go off that medication. However, it's a wonderful adjunct treatment for these types of mental wellness challenges, in addition to reducing the risk of dementia. And Alzheimer's is pretty detrimental form of dementia. We also have exercise and sleep, and this is newer in our evidence. And there's such strong evidence to suggest that when you move enough, your sleep quality improves. You have faster time to fall asleep. And sometimes that's not an issue for people. It's the second one, which is it reduces the number of times that you would wake up overnight and that length of time that you might be awake. It increases your REM sleep, which is so important for your body to repair overnight. And then it reduces that daytime sluggishness that we all get, particularly if we're sitting in class or we're sitting and studying, can help with that as well. So I already mentioned weight. We do know that when you exercise more, it can help you to maintain your weight or maintain weight that has already been lost. That's the biggest challenge. People say, okay, I can lose weight short term. The problem is keeping it off. Exercise is the key to keeping that weight loss off, but it's more than our recommended 150 minutes. It's about 300 minutes, according to research over the last 20 years. Okay, so that's important. Also, when a woman is pregnant, if she is active, she's less likely to develop excessive weight gain. That means more weight than normal. You have to gain weight during pregnancy, but it curbs the excessive weight gain, and it also reduces what we call gestational diabetes. That's diabetes that occurs during pregnancy. And if a woman gets that when she's pregnant, her chances of getting type 2 diabetes later in life goes up. And so that's important, as well as postpartum depression, because that's a serious issue as well. So you can see physical activity is such a wonderful medicine. Even without weight loss, like I said, you can be overweight, you can be obese, and still have reduced risk for chronic disease and all-cause mortality. That just means dying from any cause, if you move enough. And you can reduce your incidence of type 2 diabetes, even if you're obese. And this is the number one risk factor. Obesity is the development of type 2 diabetes. And so what a wonderful way to be able to combat those additional chronic disease states. Speaking of chronic disease states, as I mentioned a bit earlier, exercise has the ability to reduce additional comorbidities, meaning if someone has cardiovascular disease, but they move enough, it might reduce their risk for also developing type 2 diabetes. And having two or more chronic disease states makes it a lot more difficult with respect to quality of life and risk for dying of any cause. So also good at helping to slow down the progression of the chronic disease that they have and improve quality of life, which is so important for wellness and health. And then there's a particular study that I want to draw your attention to. This particular study was a meta-analysis. This is our highest level of evidence we have in research. And this particular meta-analysis by Nacy et al. Looked at the comparative effects of exercise as a drug versus pharmacological agents in mortality outcomes, dying. And so this meta-analysis was comprised of 16 studies, as you can see here on the screen, 4 exercise studies and 12 drug studies. And they're looking at the difference between the exercise intervention versus the drug intervention. And interestingly, the exercise and drug interventions did not differ at all in mortality rate, which is astounding. And in fact, you see these different disease states. In some cases, like stroke rehabilitation, the exercise intervention was actually better than the drug intervention. So what did the authors conclude? Well, they concluded that exercise and many drugs are similar when it comes to their benefits of helping patients, and that exercise intervention should be considered a viable alternative or adjunct treatment in addition to medications. And then physical activity needs to be prescribed like a medicine. And so this is what led to Dr. Bob Salas, who's the founder of our global initiative, Exercise is Medicine. It's a global physical activity initiative. And he's a physician at Kaiser Permanente in Southern California. And he's a primary care physician with an emphasis in sports medicine. He was the president of the American College of Sports Medicine, which is my professional organization and the largest sports medicine organization in the world. He said, what if there was one prescription that could prevent and treat dozens of diseases such as diabetes, hypertension, obesity? Would you prescribe it? He was asking physicians, and they were like, well, absolutely, we would prescribe it. So that's what laid the foundation for this global initiative, where the idea was to monitor physical activity like a vital sign. So when you would go into the doctor's office, your healthcare professional would ask you, take your vital signs, take your resting pulse, take your resting blood pressure. Well, we wanted exercise to be one of those vital signs, the sixth vital sign. And that was important. And then that would be monitored. And if they didn't meet the recommendations that I mentioned earlier, then they would be flagged at risk for physical inactivity. And then they would be referred to a qualified exercise professional to provide exercise prescription. So that's EIM in a nutshell. So EIM really expanded. And so this is the physical activity vital sign right here. It's a 2-question prompt. It's usually put on the electronic medical record, and it asks 2 basic questions. On average, how many days per week do you engage in moderate to vigorous exercise? And then on average, how many minutes do you do that at that level? And that way, just multiplying those numbers, we get to see, are they currently meeting 150 minutes per week or more or not? And that's as simple as it is. And so EIM, currently, it started in 2007. It now has a global presence. You can see it's all around the world. In green are all of our national centers. The lighter green are our national centers that are forming. And then the blue is just the only areas where we don't currently have EIM presence, but we have over 36 countries and it's growing. And so we're super excited about that. In 2009, I launched Exercise is Medicine on campus with Dr. Salas. We're really excited that it is the most successful EIM program to date. We have over 280 universities and colleges that are implementing the physical activity vital sign or doing other things. They might be providing education, screenings, providing opportunities to move more like you guys. And I'm really excited that UCSD is one of our gold level institutions. So thanks for being part of the team, you guys. We really enjoy having you, and we're excited about what we're able to do on campuses worldwide. EIM is also great. If you go onto eim.org, there are wonderful resources, high resolution flyers like you see here that you can print out and you can give to people. There are many of them. These are very generic right here: sit less, move more, and be active for a better life. But they also have exercise prescription for specific chronic conditions. They also have a number of them in Spanish. So it's wonderful. We can reach more people and we can reduce sedentarism and increase movement. So that's my exercise in a nutshell. Now I'd like to switch gears a little bit and talk a little bit about exercise and immunity. Now, keep in mind, I am just scratching the surface and providing a very, very brief introduction. I took an entire class in exercise immunology in grad school, and it was a very incredible experience. If you're at all interested in immunology and exercise, it's a really fascinating area. And I'm going to tell you why we need people to add to the evidence here in a little bit. So these are some of the main take-home messages with respect to exercise and immunity. Exercise improves immune function and the inflammatory response to viral infections. What does that mean? Chronic inflammation is very bad for our bodies. And so exercise can help reduce that and improve immune function. We'll talk a little bit later about how that works. It also can help reduce the psychological and physiological stress of the pandemic. Right? So exercise is a great medicine, as you saw, for both physical and psychological challenges that we might have. Exercise also helps to treat these pre-existing chronic conditions that lead to severe COVID symptoms and deaths. We're going to talk about those in a minute. And then what I find quite fascinating is that exercise can enhance the effectiveness of vaccination. So if you exercise before you get vaccinated, it actually improves your immune response. So I find that quite fascinating. So I wanted to just take a couple examples of this and of the literature. Exercise immunology, there have been over 5,000 publications just since 1990, and there's been research before that. But really, David Nieman was the first who really kind of pioneered what our modern understanding of exercise immunology is. Used his first edition softcover book in my class in grad school a very long time ago. But he and Wentz in 2019, so just a short time ago, published a manuscript looking at this link between physical activity and the immune system. And so this is the source. And so in the next few slides, I'm just going to show you the main findings. I'm also going to tell you that these photos you're going to see in a couple of these slides are my current students in ex-phys class. I have a fair number of athletes, so I love to celebrate them. So I try to put pictures up of them when we talk ex-phys. So we have Hannah and Manny. They're on our lacrosse teams, and our women's lacrosse team is ranked 10th in the nation, believe it or not. It's crazy, but we beat UF, and it was such an exciting thing. So what are the main findings between exercise and immunology? Well, acute exercise, okay, that means one bout, okay, short term, of moderate to vigorous intensity, and we're talking less than 60 minutes, supports the immune system. So it's going to improve immune function and metabolic health. We also know from all of this data that I mentioned that moderate intensity exercise seems to be the key to lowering the risk of illness. And I'll show you specifically what we mean by that. And then I've already talked about the inflammatory response being modulated. So we call that anti-inflammatory influences. And these are really important because it reduces inflammation and it can reduce tumor growth. So this is how, in part, it works on the molecular level to reduce the risk of cancer and reduce chronic inflammation. Okay. Now we have Christian and Shaylee over here. Additional findings are that habitual exercise. So now we're not just talking about one bout, guys. We're talking about over time when you are consistently moving enough. It improves immune regulation, and so it's going to delay age-related dysfunction. That means specifically age-related immune dysfunction, because our body's immune defenses or ability to fight off infections, what we also call pathogens or antigens, which are anything foreign matter that isn't supposed to be in the body that comes into contact or gets into the body. It reduces that or delays that, and it improves overall immune function. However, our historical literature to this point has said the risk of illness can actually increase for athletes during periods of intensified training. So we're talking about high volume and high intensity without proper rest. Okay, so that's an interesting finding. In fact, this is a historic J-shaped curve. This was from Nieman's earlier work that he created, looking at the relationship between exercise workload and risk for developing upper respiratory tract infection. Now, this J-shaped curve is for aerobic exercise, and it was specifically looking at runners. And so the way we orient to this basic figure is we have the exercise workload on the x-axis, so sedentary, moderate, heavy exercise. And then we have what a reduced immune response is, normal immune response, and then elevated. So it actually means that if you're sedentary, okay, then you're at greater risk for infection than if you are moderately active. So we have a reduction here. It's reduced likelihood of getting an upper respiratory tract infection. So it's protective. But now look, this high intensity exercise gives you a 2 to 6-fold increased risk of developing those. So that's the postulate behind that. Oh, you don't want intense exercise for a long period of time because that can actually be immunosuppressive or suppress the immune system, not healthy for you. So that's been the current line of thought. Now, just in 2020, there was a very interesting article that was released, and we're not going to get too much into the research part of it, but I want to tell you exercise and susceptibility to disease. So we have some researchers that think along the same lines as Neiman and the historical J-shaped curve that I just told you about susceptibility. And now we have a new group, okay, that's saying, no, we don't believe that high intensity exercise is going to do that. So it was a debate manuscript, which was really interesting and quite fun to read. And so again, this is what the yes group said. Oh no, moderate intensity improves immune response. It improves various immune markers for several disease states. But this high intensity suppresses immunity. Now, this whole point is that in this particular article, the current body of research about exercise immunology is now being challenged. Just like Joel here. Joel was on our football team and they dismantled the football team about 2 years ago. And it was really hard on the players, but you can see that Joel found an alternative activity. So quite interesting, but there's been this challenge. So what is the challenge? So can exercise affect immune function? Can it increase susceptibility to disease? Meaning, is exercise too much of a good thing, not good? Right? So the debate is yes or no. And so those who are in the yes camp with David Neiman and several other researchers, this is just another way to represent the J-shaped curve. So they're saying, yes, if you're sedentary, you're at increased risk, right? Increased illness risk because your immunosurveillance is so-so. If you participate in moderate intensity exercise, your illness risk goes down and your immunosurveillance goes up. What is immunosurveillance? That's your body's ability to recognize and become your immune system to recognize and activate to actively get rid of whatever antigen or pathogen or virus is in the way, is in the body that shouldn't be there. And then with heavy exercise, you can see illness risk increases and the body's ability to recognize and fight off infection goes down, and even more so when it's even greater intensity activity. So the other researchers, and they're from Australia, they said, no, we don't believe this. We think there are other factors involved. So we think it's people being around, like being in close quarters with one another, people being sick and being in close quarters, people not getting enough sleep, people not eating very well, people traveling, or other conditions that might compromise the immune system. So we don't think it's just physical activity. So what these two groups did agree on were these things. This is why research is so fascinating and why we always usually come up with more questions and answers, and we need more research, which is why maybe you guys would be interested in doing something, contributing to the evidence, or hopefully at least utilizing the evidence in your daily tasks and professional and personal lives. So what these groups both agreed on is that yes, regular moderate to vigorous exercise is really good for the immune system. Yes, getting infections or the susceptibility to infections is multifactorial, meaning it's not just one thing, and we really need more research, guys, on this. What they didn't agree about was, are athletes more susceptible? And we're talking about athletes who I said, high volume, high intensity training without proper rest and recovery. And then the other thing that the researchers that disagreed did not like the method by which they measured. So in the previous studies, they did saliva and they submitted their samples. These researchers that disagreed said, no, we think that it needs to be done in a laboratory, and we think that that'd be a better marker of these. So it was a matter of fact, was it immunosuppressive or was it not immunosuppressive? And that was really the question. So that's exercise and immunity. And the last thing I wanted to discuss was bringing it all together, exercise, immunity, and COVID-19. So I'm going to take you back to those top 10 leading causes of death, okay? So I'm saying here that these top 10, all of these, or 7 of these rather, are conditions that lead to severe COVID-19 symptoms according to the CDC. So what I've done is the ones that weren't included, I superimposed with other conditions that lead to severe COVID-19 symptoms. So you can see 7, and remember, 6 of those are directly or indirectly related to not moving enough. So you see how these tie in, right? These chronic conditions are what are making people unhealthy, and they are the conditions that are leading to more severe COVID-19 symptoms. What does that mean, more severe symptoms? That means your likelihood of hospitalization is high when there are severe complications. Your risk of dying of COVID-19 is higher if you have these conditions, okay? And these are just some additional conditions that lead to severe COVID-19 symptoms, okay? So let's think about that for a second. And I'm gonna just have 2 more things that we're going to talk about. And this is like new research, you guys. So this study was published in January of this year, and it's about a 7-minute video, but I'm only going to play the first 4 minutes. But I wanted to just give you a little bit of background in case you weren't aware. Does anybody know what a MET value is? That first bullet. What's a MET value? Do we know? Anyone? It's an ex-phys term. So a MET value is what we call a metabolic equivalent. And what it is it's a way that we can assess the intensity of an activity. So 1 MET equals 3.5 ml per kg per minute. 3 ml per, that value right there is what we call resting VO2, or our oxygen requirements at rest. All that means is what you're doing right now, sitting but being attentive, that's about the amount of energy that you require, okay? So it's in relation to the amount of oxygen that you consume, just to give you a reference point. Now, why METs versus calories, right? Because people understand calories better. Because if you and I were to walk a mile at the same pace, we would have equal MET values. If you and I were the same weight, we would have equal caloric expenditure. If I weighed twice as much as you, I'd have twice as many calories that I burned or expended than you did. So MET value gives us kind of an even scale that we can compare people with. And it's much better than these complex equations that we'd have to use otherwise. Okay, so that's what I wanted to say. Let's go ahead and watch just the first 4 minutes or so of this video so you get a good understanding of what's going on here.
We found that maximal exercise capacity was independently and inversely related to the likelihood of hospitalizations due to COVID. Those who were hospitalized had a significantly lower peak MET level compared to those who were not hospitalized, and this was about a 1.3 MET difference. Also, peak METs were inversely related to the likelihood of hospitalization due to COVID. In the adjusted analysis, which accounted for the 13 conditions that the Centers for Disease Control deem as possibly or definitely related to the increased risk of severe illness from COVID, each 1 MET higher peak fitness level was associated with a 13% lower risk of hospitalization from COVID. So the take-home message from our study is that higher peak fitness is related to a lower risk of hospitalization from COVID. Hi, I'm Dr. Jonathan Ehrman. I'm the Associate Program Director of Preventive Cardiology and a clinical exercise physiologist at Henry Ford Hospital in Detroit, Michigan. On behalf of my co-authors, particularly lead author Clinton Bronner and senior author Stephen Catan, I'm discussing our paper titled Maximal Exercise Capacity is Inversely Related to Hospitalization Secondary to Coronavirus Disease 2019, which is published in the Mayo Clinic Proceedings in the January 2021 issue. This analysis evaluated more than 18,000 patients who received a clinically indicated stress test in which peak fitness capacity expressed as metabolic equivalents of task or METs was determined. These patients were assessed between February 29th and May 31st of 2020 for a SARS-CoV-2 test using the PCR analysis method. We identified 1,181 patients with a SARS-CoV-2 test, and of these, 21% or 246 individuals had a positive test. And of these, 36% or 89 individuals were hospitalized. The aim of our study was to determine the relationship between the peak METs and the risk of hospitalization for COVID-19. Our study has several strengths and limitations. First,
all right, I think you got the
generalized.
gist of it there, right? So anything over 1 is an increased intensity. So those that can function at a higher intensity, or when they were tested, they were the ones who had the lower risk, right? So when you do an exercise test, when you do a maximal exercise test, that's one of the ways that you can show your maximal effort, which is what is your MET value, okay? So that maximal exercise test gives us an indication of aerobic fitness. Okay, so now we have a study that suggests exercise is a great medicine to try to reduce the severity of COVID symptoms should you get it. So here's another study, which interesting enough, it just came out 1 week ago today, and it's by Dr. Salas, who started Exercise is Medicine. And in this particular study, I'm going to explain it. And he was kind enough to give me his few slides that he's created about this. So I'm excited to be able to share this. So what Dr. Salas did is he took these Kaiser Permanente patients from Southern California with a COVID diagnosis. So it would have been between January and October of 2020. Now, keep in mind, he stopped that data collection, and it takes a while for something to get published. In fact, anything related to COVID is published a lot faster than normal. And the nice thing too is that it's free access. So they're not making you have to subscribe to a journal to be able to get that. So out of all those patients, there were over 100,000. You can see there, 103,337 patients. Then he wanted to make sure that they were with Kaiser Permanente for at least 6 months or more. So that took it down to 84,377. And then he wanted to make sure that there were at least 3 exercise vital signs that I told you about, that 2-question prompt. These measures were taken between March 2018 and March 2020. Okay, so the historical physical activity. So this was kind of a retrospective observational study like the other one that we just heard about. So this is the result. The exercise vital sign, he looked at 3 different categories. Consistently inactive, they didn't do anything, like 0 to 10 minutes per week. Inconsistently active, or some activity, which was 11 to 149. So either they weren't active consistently. One time they didn't meet the recommendations, another time they did, or they just didn't quite they exercised, but not enough to meet the recommendations. And then the last one was meeting the guidelines. So we just have a couple more slides left, and I'll make it very simple. You can see here on the left, the exercise vital sign and percent hospitalized, significantly greater percentage of people that did not move at all were hospitalized than those who did. That's a pretty substantial increase. And those that somewhat moved were kind of right in the middle, as you would expect. Now, the one on the right is those who died from COVID-19. You can see, again, a drastic increase in people that didn't move to those who did. So exercise acts as a protective measure to not getting severe COVID symptoms and not dying should you get it. Now, the jury's still out on, can it help prevent, right? So we know exercise and immunity and what that does, but we still need more time to figure out, can exercise help prevent this from happening at all, like you from having symptoms of the disease? Okay, so that's really important. And I attended, not too long ago, I attended a global webinar on exercise, immunity, and COVID-19. And this world-renowned expert in the area said, there was a question that said, how can one bout of exercise, how can that help? And his response was, when you have a bout of exercise, it immobilizes your immune cells, right? And since they're activated, they're alerted, they're more efficient at trafficking through the body and responding to any antigen. Same holds true for how exercise can improve vaccine effectiveness, okay? Because it would just be that it's introduced in a different way. So then Dr. Salas looked at these, remember those 13 signs or symptoms of severe COVID, and he looks at odds ratio. And odds ratio is an epi term, and all that means is that 1 would be no risk, okay? Below 1 would be a protective, and above 1 would be increased risk. And you can see here, when you looked at those that are inactive versus active, they're over 2 times more likely to be hospitalized. Those odds are just as bad as someone who is over 60 and who's had an organ transplant. That's how powerful or how bad it is if you don't move, and how powerful it is if you do. Okay. So now the inactive versus some activity was kind of in the middle, right? So a little bit greater risk. Now, when we look at people who've died from COVID, now we see again 2.5 times the risk of dying if you don't move enough. Now, it's not quite as bad as being older or having an organ transplant, but still very much increased risk. Okay, and again, somewhere in the middle for those that were somewhat active. So what's the bottom line here? Let's wrap it up. Exercise is a powerful medicine. Exercise does have a profound impact on the immune system, a very positive one. And there is emerging evidence that supports the role of exercise in the reduction of severe symptoms and death from COVID. So here are some of my resources that you guys can look at a little bit later if you'd like, all of the resources for the studies and some EIM resources as well. So thank you so much for your time. Are there any questions? Oh, thank you. So what questions do you have? You have any questions? My email is right there, cwinter2@ju.edu. If you have any questions. I'm not an expert on COVID-19, but I know a little bit about exercise and immunity. So how can I help you? Yes, Alexandra.
Hi, I came in
Hi.
a little late, but could you do a quick recap again on how exercise is linked to immunity? I think I came in like just at the last part, like when you finished talking about that.
Yeah, so it does improve immunity, the immune response, and it helps to reduce chronic inflammation. It helps us manage chronic disease states that are linked to the most severe symptoms of COVID, and it can actually enhance the effectiveness of vaccinations. We've seen that with the flu, and we're starting to see that with COVID-19 as well. And then the next few slides, and you'll be able to look at the recording, the next few slides just go into detail about what some of those are, like moderate intensity activity seems to be best, not too strenuous, and that it can help reduce, if you do it over time, it can help reduce the age-related decline in the immune system, and it's good for overall health. So that's pretty much it. Did that answer your question?
Yeah. And
Good.
I noticed you said also towards the end that there still needs to be more studies on like if it truly prevents certain things from happening. But for
Yeah, so I may have been referring to the fact that if you participate in high intensity, high volume exercise, it might actually be immunocompromising, where you can see right here on this J-shaped curve. So we need a lot more research to understand that better. We also need more research to understand, is exercise a good prevention? Does it help prevent getting COVID? Or does it just reduce the severity of symptoms and potential death from the virus?
thank
Good
you.
questions.
This
Thank
is
you.
really interesting.
Good. I'm glad you liked it.
I think,
Anybody else?
yeah, based on the presentation and kind of what you mentioned about reducing the severity in those hospitalizations and those trends with those symptoms, and potentially even increasing vaccine efficacy, why do you think that it hasn't been publicized as much? Like, it sounds like there's a lot of upside, a lot of potential for upside, and very little downside. So why haven't we heard more about like the potential value of exercise in the midst of this pandemic, right? Like, we see everywhere now, like, oh yeah, get vaccinated, which is a great first step. But, if there's something that can even increase vaccine efficacy, I feel like the general public should be more aware of that, right?
Yeah, Bob Sellis says that, Dr. Sellis says that all the time, just about exercise in general and how it can reduce chronic disease. And now when you add the pandemic, so in the beginning, and this is exactly what he would say and what I would concur with and say is that, in the beginning we were told stay in, stay away from people. Yes, you need to take precautions, but exercising and exercising outdoors seem to, both are essential to reduce these chronic disease states that are causing the most trouble with COVID-19. So I agree. And I wish I knew the answer. Part of it might be the vaccine hesitation. Part of it might be that, we're just starting to get evidence to support exercise specifically for COVID, but clearly for all these other chronic disease states. But I agree with you. If you have any suggestions on how to get the word out, please let us know, because we've been trying to do this for quite some time. And that's why I preface it by trying to change the conversation from exercise is good to, wow, it's really bad if you don't move enough. But yes, you're absolutely right. So I'm counting on you guys to help spread the word. Can you do that?
Yeah, absolutely. I think this presentation is a fantastic start to that. We're definitely going to post it, on YouTube, try to get it out to our audience for sure.
Excellent. Well, if you don't mind sending me the YouTube link, that'd be great. Okay, very good. Any other questions?
If there are no other questions, I do want to let Dr. Winters out now, because for her, for us, it seems like it's just 8 o'clock. For her, it's 11. She's doing this from, Eastern time. So please, in the chat, thank her, maybe give some hand clapping emojis, whatever it may be, because, she really took time out of her day to give this presentation. So thank you so much, Dr. Winters. It was a fantastic presentation. And you were an amazing speaker.
Thank you. I appreciate that. All right. Well, you guys take care, be safe, and move. Okay.
Absolutely. We'll spread the word. Spread the
word. Yes. Yes. Thank you. You be our champions.
Have a great rest of your night.
You as well. Good night.
Thank you.